Your kidneys can start losing function long before you feel sick, and sometimes the first warning isn't pain. It's a small change you might easily ignore. You might still feel completely normal. That's why knowing the early clues and understanding when testing may be useful can matter. Today, we'll look at 7 possible clues that your kidney function may be changing and why some of them can be easy to miss. Another possible clue is persistent fatigue. When kidney function is significantly reduced, several changes in the body can contribute to feeling unusually tired or weak. For example, advanced kidney disease can be associated with anemia, which may reduce the blood's ability to carry oxygen efficiently. But fatigue is extremely common and can come from sleep problems, stress, medications, anemia, nutrition, and many other conditions. By itself, it isn't a reliable way to identify kidney problems. And here's where things become more interesting. Your body may also start holding on to extra fluid. Your kidneys help remove extra fluid from your body. When kidney function is reduced, the body may retain more fluid, which can contribute to swelling. Swelling may appear around the feet, ankles, legs, hands, or sometimes around the eyes. But swelling doesn't automatically mean your kidneys are losing function. Heart problems, medications, circulation issues, and several other conditions can also cause it. But there's another change that can be even easier to overlook: what happens to your appetite. Another possible clue is a change in appetite. When kidney function becomes significantly reduced, some people may experience nausea, reduced appetite, or a general feeling of being unwell. In more advanced kidney disease, waste products can build up in the blood and may contribute to nausea or changes in appetite. But appetite changes and nausea are extremely nonspecific. They can also happen with infections, digestive problems, medications, stress, and many other conditions. And sometimes the clue isn't something you feel at all. It can show up in your muscles. Your kidneys help keep minerals and electrolytes in balance. When kidney function is significantly affected, changes in that balance may contribute to muscle cramps, weakness, or unusual fatigue. However, muscle cramps are common and can happen for many reasons, including dehydration, exercise, medications, circulation problems, and other medical conditions. So if cramps or weakness keep happening without an obvious explanation, it's worth discussing them with a healthcare professional rather than assuming your kidneys are the cause. But there's one clue that's especially important because you may not notice it from a symptom at all. It can show up in your blood pressure. Your kidneys and blood pressure are closely connected. So a change in kidney function can sometimes affect blood pressure regulation, and high blood pressure can also place additional stress on the kidneys. That's why consistently high blood pressure can be an important kidney health risk factor, especially when it remains uncontrolled over time. And because high blood pressure often causes no obvious symptoms, regular monitoring can be especially important if you have other kidney risk factors. But here's the most important clue of all. Sometimes kidney function can change without causing any noticeable symptoms. Here's the important part. Kidney function can sometimes decline without obvious symptoms. That's why blood and urine tests can be so valuable. A blood test can help assess kidney filtration using measures such as creatinine and estimated glomerular filtration rate, while urine testing can look for things such as albumin. The meaning of these results depends on your age, medical history, and other factors. So a single test result should always be interpreted by a qualified healthcare professional. So don't wait for severe symptoms before paying attention to kidney health. Knowing your risk factors and getting appropriate testing when recommended can help reveal changes that you might not feel. So if kidney function is changing, the clues can be subtle. You might notice changes in urination, persistent fatigue, swelling, appetite changes, muscle cramps, or blood pressure changes. But remember, these symptoms can have many different causes, and early kidney disease may cause no noticeable symptoms at all. That's why appropriate blood and urine testing can sometimes be more informative than symptoms alone. If you have high blood pressure, diabetes, a family history of kidney disease, or other risk factors, ask your healthcare professional whether kidney testing is appropriate for you. Subscribe to VitalBites for simple, evidence-aware health information that helps you understand your body better. This video is for educational purposes only and is not intended to diagnose or treat any medical condition. If you have concerns about your kidney health, speak with a qualified healthcare professional.